There's a responsibility from leaders to use terminology that doesn't diminish what's happening, for both patients and healthcare workers.
Incidental COVID cases. It's a new category that the province is using when it comes to painting the COVID picture in Alberta. But one doctor says it's minimizing the burden that Omicron is having on our healthcare system. Moments before Premier Jason Kenney announces the lifting of some COVID restrictions, he paints a picture about COVID case numbers.
About 40% of patients in the hospitals who have tested positive for COVID are not actually being treated for COVID. They are what we call incidental cases.
OBGYN Dr. Stephanie Cooper says in medicine, the term incidental is used to talk about something doctors discover that they weren't looking for and may not relate to the issue. She says COVID is different.
Often, if people are sick enough to be admitted in hospital, it's likely that a diagnosis of COVID would impact their care, and therefore that's not considered incidental.
Contrary to popular belief, Cooper says not everyone who comes into a hospital is tested for COVID.
If they don't have symptoms, they're not tested. And so therefore the ability to find an incidental case, recognizing it's a nasopharyngeal swab, you have to test for it for a reason. You're not just going to find it.
We reached out to the province for clarification on what an incidental case is defined as. They wrote in part, it means neither a primary nor a contributing cause of admission, as in the person was admitted for something else. That's a clinical judgment made by the admitting doctor in each case. For COVID, same as anything else. COVID symptoms could be minor at the time of admission and clearly irrelevant to the admission, or there could be no symptoms on admission at all. Meantime, Cooper says while this new category of cases may help paint a less dire COVID picture, these COVID cases still place a massive burden on the healthcare system and the patient's well-being.
It's trying to find a patient bed on a ward where they can have a private room, and then trying to find the staff to care for those patients. And in some cases, the staff who are caring for COVID patients, that's not also their area of expertise.
At a time when it is bursting at the seams, with over 1,600 COVID hospitalizations and over 120 patients in the ICU. In Calgary, Tara Overholt, City News.